Okay, so I think we're going to keep right on going here so we stay on time. The next speaker is myself. I'm Dr. Lee Dresser, and I am the medical director of the Sleep Center at St. Francis Hospital, and am also a neurologist, and was interested in speaking to you all for a few minutes today about sleep and stroke. And we get started here. So I have no disclosures. So both sleep disorders and stroke are fairly common disorders. So they would occur just coincidentally together fairly commonly. And there also is an association of sleep disorders with stroke and stroke causing sleep disorders. So it's kind of the yin and yang symbol. The yin and yang symbol is the symbol of the American Academy of Sleep Medicine, I think, illustrating how sleep goes into wakefulness and wakefulness goes into sleep, and it's kind of a continuum. And I thought that was appropriate, for sleep disorders and stroke. This has been a fairly well reported on area. In researching for the talk, there's been quite a few review articles that have come out just this year, just in the last few months. So just illustrating again that sleep disorders can contribute to stroke, and stroke can in turn contribute to these same sleep disorders. So we're going to talk just about three different topics today. I'm going to talk about just sleep and stroke in general, and talk about a little bit about stroke and parasomnia, and mainly going to talk about stroke and sleep apnea. Sleep apnea is probably the most common sleep disorder that is associated with stroke. So just some facts about sleep and stroke in general. A fair number of strokes occur during sleep, and even a large amount of strokes occur in the morning, going from sleep into wakefulness. In the 6 hours in the morning, there is a proportionally larger number of strokes that occur. Maybe about half the strokes would occur in just a quarter of the time of the day. So there seems to be something about going from sleep into wakefulness in the morning that predisposes to stroke. And we'll talk a little bit about what that is and how that is affected by sleep disorders. This was a very large review study that was done a number of years ago, looking at the duration of sleep, either short duration of sleep, people that slept shorter than quote-unquote normal, or people that slept longer than normal. And what is normal sleep is somewhat just really an expert opinion. It is a question that has been addressed by the American Academy of Sleep Medicine. And the answer that typically comes out, and it's been pretty consistent over the decades, is that for an adult meaning somebody who's 25 years or older, that you probably need about 7 to 8 hours of sleep per night. Now that is really a spectrum, but I think if you follow that yourself, which I try to do, and if you recommended that to your patients, you're not going to be far off. There's probably one side of the bell-shaped curve. There's a number of folks that really can get by with 5 or 6 hours of sleep every night, and God bless them. They're going to be seeing a lot more DVDs than reading a lot more journal articles than I'm going to be. And then there are probably some folks that quote-unquote normal long sleepers that really might require 9 or 10 hours of sleep to really function at their maximum. But the majority of us live in that middle of the bell-shaped curve where you need like 7 to 8 hours of sleep. So for the folks that don't get enough, they are at increased risk. This one study showed that for folks with less sleep, it was really just women that statistically significantly were at increased risk of stroke, not men. Now, there's been a subsequent large study that showed it was actually both men and women were at a high risk for increased risk of stroke with a shorter than quote-unquote normal amount of sleep. And both studies, or all the studies I've seen, have shown that for people with too much sleep, greater than normal amount of sleep, that they also are at increased risk of stroke. And it's probably somewhat complicated why this is. The folks that have other medical problems, those problems likely contribute to their need for greater sleep, and that it may not just be too much sleep puts you at increased risk for stroke. It's why are you getting too much sleep? But all other things being equal, it's probably good to live in the sweet spot, where you're sleeping 7 to 8 hours a night, and not shorting yourself of sleep and not sleeping your life away. It was shown, it's kind of the yin and yang thing. We're talking about that stroke patients are somewhat predisposed to excessive sleep, and a fair percentage of the stroke patients, when followed, actually get a large amount of sleep, probably because their brains are too sleepy as an effect from the stroke or strokes. So why would it be? Why would sleep deprivation put somebody at an increased risk of stroke? And it's hypothesized that when people don't get enough sleep, they have an increased sympathetic nervous system activity, which could translate into higher blood pressure, increased risk of heart disease, arrhythmias, both of which are major risk factors for stroke. There is an effect for people don't get enough sleep. There's an association with not enough sleep with increased weight, which is something I tell many patients daily, that if you want to lose weight, you need to make sure you get enough sleep. It probably causes increased ghrelin level, which ghrelin is the hormone that increases our appetite, and decreases the leptin, which is the appetite satisfying hormone. So that just one other reason why it's important to get enough sleep. In folks that have stroke, there's a significant problem with either increased sleepiness or, conversely, with insomnia. And it is probably dependent on the location of the stroke, especially brainstem strokes. Our brainstem really kind of contains the on-off switch for our sleepiness, the activating centers or the centers that promote sleep. And if you have a stroke in just the right or wrong place, it will probably tip the scale towards making folks more sleepy or less sleepy. Fatigue is a real common problem in stroke, and one of our other speakers today, Dr. Kleinditz, is going to really be speaking right to this, but it's a real common problem. This number, 70%, is seen in a lot of studies that even in addition to sleepiness, the patients just are fatigued. They just don't have energy. Mentioned that brainstem strokes, if they are in what's called the activating center of the brainstem, can lead to significant hypersomnia. And conversely, strokes that are in the areas that promote sleep can lead to insomnia. And insomnia is a common problem really from the time of stroke, and talking about the acute stroke patient in the hospital. And people have looked at how does somebody do as far as their rehabilitation if they're not getting enough sleep, and not surprisingly, they don't do well. So it's probably something we in the hospital need to do a better job at. If we have an acute stroke patient, we're going in every few hours to check their blood pressure, their blood sugar, check on them, and we probably should leave these patients in a better environment to promote sleep, which in turn has been associated with better outcome from their stroke. These folks that from the acute into the subacute time, if they are significantly sleep deprived, their risk of stroke is increased. And there's a lot of simple things we could do in the hospital or even in the rehab setting or at home. As far as just their environment, having a quiet, dark environment. It's kind of like the three little, or the three bears, Goldilocks. Not too, warm, not too cold. Dark enough so somebody can sleep well. Regulating caffeine, A lot of simple things that can be done even without medicines. Medicines are kind of a double-edged sword in that if people sleep better, they tend to do better as far as rehabilitation, but some of the common sleep medicines like zolpidem and benzodiazepines actually are associated with increased risk of stroke. So probably the take-home is the less medicine we use for our stroke patients and probably for our sleep patients in general, the better off we are. I really try to instruct patients in good sleep habits. I have a sleep hygiene handout, which I give to folks and which are readily available online. And I would encourage folks to do that as opposed to just recommending a drug to help sleep, which is occasionally necessary. But the good sleep habits have no side effects, and they're free. And a lot of times those things are as effective as the medicines. And on the other side of the scale, hypersomnia is a common problem. Epworth's sleepiness score is of greater than 10 is a measure of pathological hypersomnolence, and a fair number of stroke patients will have high Epworth scores, and this would be even independent of having some condition like sleep apnea. And I mentioned that for the folks that have sleep problems, it has been associated with decreased rehabilitation and increased recurrence for stroke and mortality. Increased white matter abnormalities, similar to what Dr. Wozniak showed in her talk, the white spots in the, I'm not sure if this is working. But you can see the little white spots in the brain there. This is a common condition that we see in people that have had stroke, or even people that don't present with stroke, that they have a number of small little infarcts, and that is associated with increased sleepiness and fatigue. The MRI looks kind of similar to what we see in patients with multiple sclerosis, and similarly, multiple sclerosis is a disease where fatigue is a real common problem in MS. Dr. Goldenberg said in his topic that or his talk that there are lots of cardiac manifestations. You can have heart failure, you can have arrhythmias, you can have myocardial infarctions. Analogous in the central nervous system, you can have an MRI or a CAT scan like this without necessarily presenting as a stroke. So this is probably the number 2 cause of dementia, the so-called multi-infarct dementia behind Alzheimer's disease. So it's a significant problem, and definitely impacts with sleep. Treatment for hypersomnia is somewhat difficult and not really terribly satisfying. People have used these dopamine agonists, bromocriptine, modafinil, which is Provigil, which is a medicine we use to treat narcolepsy with, can help folks, methylphenidate, Ritalin, occasionally for people that have significant fatigue and sleepiness, these medicines can be helpful. Like any medicine, they obviously carry the potential risk for side effects, so have to be used carefully. Just some interesting kind of case studies that there are some reports of a few patients that develop narcolepsy after a stroke, usually from a brainstem stroke that almost clearly was due to the stroke and not due to the typical genetic causes of narcolepsy. An interesting disorder in sleep that I'm just going to touch on briefly is called REM behavior disorder. And REM behavior disorder, or rapid eye movement behavior disorder, is a condition where people act out their dreams. And when we normally sleep and we go into dream sleep, our bodies are paralyzed, except for our eyes, which continue to move, and our diaphragm. But it's kind of nature's way of making sure we don't act out our dreams. It is probably regulated by a site in the pons part of the brainstem, and that if there is a stroke that hits in just the wrong place, people can develop this condition. And in brainstem strokes, it's fairly common. You can see it in a large percentage of people that have brainstem strokes, as this one study pointed out. Just real quickly, talk about restless legs and periodic limb movements of sleep. Common conditions, and do have a bit of association with stroke. Restless legs syndrome, very common. It's something probably it's just good for us all to know about. The four characteristics of it are a desire to move the legs. The legs feel restless. It's worse when people are resting, when you're sitting, like a long car ride, during a movie, during a play. Worse later in the day, and it's relieved by getting up. If somebody meets all those four criteria, then there's really nothing else it's going to be besides restless legs.